Juan, I'm going to be doing my sinus trigger. So first thing you want to do to make sure is that your bucky's lined up to the tube, and what mine already is, that you're at 40 inches. I'm going to make sure that it's wiped down and clean because the patient's going to be putting their face up on here. Got my shield ready. So I'm going to go ahead and call my patient, all right? Luis?
Yes, sir.
Send me your first and last name.
Luis Juarez,
And then date of birth.
7/27/94.
All right, and then what's the reason for the visit?
I have a sinus infection.
Sinus infection? All right. So I'm actually going to have you sit down on this chair, okay? Any possibility of pregnancy?
No, not today.
Not today? Okay. So go ahead and sit on this chair, put this vest on. Put it on? Yeah. So let's start with our lateral projection. So I'm going to have you kind of scoot up a little bit towards me. And then guys, I need you to open up your body a little bit. Now it's an awkward position. You have your head, face up against the board. There we go. So then we want mid sagittal plane parallel with the bucky. We're going to center 1.5 or 1 inch, half an inch to an inch posterior to the outer campus. So I need to move them just a little bit. Scoot away. Yeah. Scoot. Switch your head up just a little bit. Should bring it down. A little bit lower. There we go. Make sure my bucky's lined up. It's gonna move okay. Left side, so I like to have the left marker up. Technique is gonna be 80 at 6 or to 10, somewhere around there. Just gonna cone in a little bit. All right, hold still just like that. Sorry about that. Do it half the other way, okay? Doing okay?
Doing great.
All right. Just like that. All right, don't move. Hold your breath. X-ray. All right, so now we're gonna go to our next image. Breathe. My bad. You can get your head off the plate. You're gonna be facing forward, so scoot your chair. And then you can put your arm around this one too. Yeah, just like back there. All right, so for this next one, it's Waters. So Waters method projection. So I need you to come up close. You need to have the MML perpendicular to the plate. So just a little bit lower. That's good right there. You want it exiting the acanthion. So just open up my combination a little bit. There, it's gonna go up, okay? Just like that, close up a little bit. Left side marker down. Technique, it's 80 kVp at somewhere between 16 and 20 max. All right, stay just like that, okay? All right, hold your breath. X-ray. All right, breathe. So now for this next one, I need you to put your head down just a little bit. Want the OML perpendicular to the plate, and then we're gonna go 15 degrees up. So just gonna move it a little bit right. Just like that. Stay just like that. We want it entering at the nasion. So, put it. Line on my bucky. Left marker down. Calm it a little bit more. All right, hold your breath. X-ray. So my technique for that would have been, you can breathe. My technique for that would have been somewhere between 80 and 16 and 20 mass. All right, so for this next one, I need you to turn all the way over. I'm actually gonna get this vest off you, okay? Okay. Just like that. Put this on. This is the SMV projection, so I need you to tilt your head. It's gonna be an awkward position, but you have to tilt your head back really far, okay? So just like this. Sorry about that. you want to enter at the in between the angles of the mandible, and you want to be 3/4 of an inch anterior to the EAM. So about there. Line up the bucky. Right marker down. Collimate technique. Almost the same thing between 80 and 16 and 20 mass. Just try to hold still, okay? Hold still just like that. Hold your breath. X-ray. Now you can relax. Head back. We're all finished, okay? Sorry about that, all right? Get this rest off you. And we'll walk you outside, all right? All right. So that's it. All right, this is the image evaluation portion of the sinus trigger. So I'm going to be starting off with the lateral projection. To start off with, you want the CR to enter 1/2 inch to 1 inch posterior to the outer canthus. You want all 4 sinuses demonstrated, which in the picture it, did a good job of that. Make sure that there's no rotation or tilting of the cranium. And you want to make sure that you have optimal exposure factors. In this picture, they probably could have collimated more to include less of the mandible, because that's not necessary for the picture. So there's that. Then next we have our PA projection and the Caldwell. And you want the OML 15 degrees up from the horizontal plane. And then you want the CR to exit the nasion and also for it to be horizontal. You want the frontal and ethmoid sinuses demonstrated, which they are here. Then the petrous ridges to be in the lower 1/3 of the orbits, which I think it's might be a little too low here, but still looks kind of alright. No rotation or tilting again. Optimal exposure factors. And it looks like they probably could have collimated here as well to include less of the top of the skull and less of the jaw too. And then the marker's in the wrong place too, so, or they used the wrong marker, I don't know. Could have flipped it. And next one is the waters, or the parieto-acanthial projection. And for this one, you want the MML perpendicular to the IR, and then you want the CR to be horizontal and to exit at the acanthion. And you want the maxillary sinuses demonstrated, which they are in the center. 1, 2. No rotation of the cranium, the petrous ridges below the maxillary sinus, which it's kind of hard to tell, but they are. And then once again, optimal exposure factors. Marker's in the right spot on this one. They probably could have coned in a little bit more too here, but it looks okay. And then the last one is the SMV. You want the IOML to be parallel to the IR. You want a horizontal central ray to enter between the angles of the mandible. And then you want the mandibular condyles anterior to the petrous ridges, which they are here. No rotation or tilt. Once again, looks like I think they did a pretty good job. But, kind of looks a little rotated. The correct collimation, and then optimal exposure factors too. So this image looks pretty good. I wouldn't repeat. So that's about it.